First of all, thank you, Chair Frank, for laying out this bill. It takes a great amount of courage to do something in this where there is so much consolidation and vested interest in keeping the system in place. So we appreciate your efforts and really all of this committee. Chair Frank laid out that there's been so much effort in the past on transparency. And transparency has been so important, but it's only the first step. What we are really looking for is healthy marketplaces. And healthy marketplaces require informed consumers, they require competitive marketplaces, and they require engagement. So informed markets are ones that have transparency. We've done good work on there, we're going forward. But what we need to do is take advantage of choices and have people who are engaged to make the right decisions. In healthcare, we see a massive amount of price variation. We've seen stories about people talking about the differences in prices that occur on an order of 10 to 1. You can go in and get an MRI for $500, or sometimes it costs $5,000. You can go have a delivery of a child that maybe costs $4,000, or maybe it costs $25,000. This price variation doesn't exist in any other market that we're aware of. And so we have to wonder, what is it that we're going to do with this transparency that has revealed the extent of price variation? Intelligent employers would design smart benefit plans that allow them to take advantage of this new transparency and drive their employees to go seek high-value care, that is high-quality care that is at a lower price. So we should be able to utilize this new transparency to take advantage of that. Unfortunately, we see that consolidated actors have abused that position of their market power to prohibit those intelligent designs. Most importantly, the steering and tiering provisions that are prohibited by contract. So just to give an example of this, we saw this. This isn't just hypothetical. In California, Sutter Health was accused and had to settle for taking advantage of their market power and prohibiting employers and insurers from being able to steer their enrollees to high-value providers. They settled for $575 million, as well as injunctive relief, where they agreed not to engage in those anti-competitive practices for 10 years. This is the sort of behavior that we are trying to prevent from taking hold in Texas. Representative Ollerson, you brought up an excellent point here today, which is that insurers are also doing the same thing. They consolidate and they are buying up provider practices as well. We don't want them to engage in unfair self-dealing. Fortunately, the bill imposes on them when employers and insurers are going to steer or tier a fiduciary duty, which is the highest duty the law can impose, that they do so only for the primary best interest of the patient. And by imposing that fiduciary duty, when we are enabling this steering and tiering to occur to the high quality care, it is being done again for the primary interest of the patient. Because as you note, that's happening on the insurer side too. And we want to be equal opportunity offenders here to create a level playing field. With that, I'll take any questions that do exist.
Thank you. Members, are there any questions? The chair recognizes Chairman Frank.
No, I just wanted to thank you for your help in working this bill, working through some of the details with us, because you've done a lot of work in the background, and so really appreciate the effort of you and your organization.
Thank you.
Thanks.
And I as well want to express that thank you for always being there when we need you.
Thank you.